Why is ADHD diagnosis difficult in autistic adults? Have you ever wondered why diagnosing attention deficit hyperactivity disorder in autistic adults can be such a challenge? It's a question that many people have, and the answer lies in the overlapping symptoms of both conditions. Autism spectrum disorder and attention deficit hyperactivity disorder share several features, making it tricky to distinguish between the two. For instance, difficulties with attention, impulsivity, and social interaction are common in both conditions. This overlap can blur the lines, leading to confusion during diagnosis. A behavior that seems like inattention, such as not responding when someone speaks, could stem from ADHD. However, it might also be a result of social communication differences typical of autism. Clinicians face the tough task of figuring out if these behaviors occur mainly in social situations or if they happen when the person is alone. ADHD-related distractibility usually appears regardless of social context, while autistic sensory sensitivities might cause distraction due to environmental factors. Another layer of complexity comes from the fact that many autistic adults develop coping strategies or mask their symptoms. This is especially true for females, who may imitate social behaviors to fit in. This masking can hide symptoms of both autism and ADHD, making it harder for professionals to identify the true underlying conditions. Moreover, the tools used for diagnosing both conditions were primarily designed for children. Their effectiveness in adults, especially those with both conditions, is still being studied. For example, the Autism Diagnostic Observation Schedule is helpful for assessing autism but may overlook ADHD symptoms or interpret them through an autistic lens. A thorough assessment is essential. This includes a detailed developmental history, cognitive testing, and evaluation of functioning across different environments. However, these assessments can be time-consuming, which adds to the challenge. Research suggests that between 20% and 37% of autistic adults also meet the criteria for ADHD. When these two conditions occur together, they often lead to greater challenges in daily life, such as issues with organization, time management, and attention. For autistic adults seeking an ADHD diagnosis, it is important to find clinicians who understand the relationship between autism and ADHD. They should use various assessment methods and consider individual differences, such as gender and coping strategies. An accurate diagnosis can lead to tailored interventions that improve daily functioning and overall well-being. In summary, diagnosing attention deficit hyperactivity disorder in autistic adults is difficult due to symptom overlap, masking behaviors, limitations of diagnostic tools, and the need for careful evaluation. Addressing these challenges requires specialized knowledge and a thorough approach to ensure individuals receive the support they need.